Evening.
My name is Eddie. I'm retired and I'm Medicare. My 42-year career included over 12 years executive level finance and risk management, including CFO of Blue Cross and Blue Shield of Wisconsin.
Louder.
Miles Zaremski will speak shortly, and I have been involved locally and nationally, working with Washington's Healthcare for America Now, with Wendell Potter, and with the media. I'm not here tonight to convince you the bill is good. Far from it. I'm here to say that this bill is necessary, and in context, as transformational as Medicare was in 1965. The opposition bellyached about Medicare then, and is doing the same now. But would you check Medicare? Me neither.
No.
Indulge me with a story you've heard before. A teacher pours marbles into a large jar and asks the class if it's full. Of course it is. The teacher then pours sand over the marbles and with a shake or two, refills the jar. Again, the teacher asks if it's full, and again the answer is sure. The teacher then takes a cup and pours water into the jar. Now is it full? Indeed, now it is finally full. The moral here is the need to prioritize. Address the big items first, and there's room for the smaller things. Get it reversed, and just sweat the small stuff, and there's no room for the marbles or the big items. Make no mistake, people. Passing healthcare reform is about the marbles. No ifs, ands, or buts. Lesson number 2. Politics is the art of compromise. If we take an intransigent stand, right or left, we lose the middle of the country. Rally as hard as we like. What do you want? Reform? When do we want it? Now. But when reality hits, we're not going to get everything now. Don't be disappointed. Rather review your priorities. Count your marbles. You don't need to win them all. Let's look at some of the marbles coming down the pike. Pre-existing condition to deny coverage will be illegal.
Yes.
Solo rescission. That's canceling after you paid your premium, again from pre-existing conditions. These aren't marbles. These are friggin' basketballs. These are huge wins. But wait, there's more, says huckster Billy Majors. If you already have a serious health issue and uninsured, your wait is almost over. Reform calls for a prompt setup of high-risk insurance pools that charge reasonable rates. No more $2,000 premiums and deductibles. Folks, I'm just warming up. How about reasonable annual out-of-pocket limits? Too many people face severe financial problems meeting high annual bills. Next, kiss lifetime limits goodbye. That is what is sending millions into bankruptcy. The ball is rolling. Are you with me?
Yes.
No cost sharing for preventative health care. Ben Franklin is right. An ounce of prevention is worth a pound of cure. Deductibles and copays shouldn't stop you from getting the needed attention. And if you have kids that can't find a job in this rotten market and move back home, dependent coverage will extend to age 26. At the other end of the age spectrum, there are those over 55 whose COBRA from work runs out. That gap closes with COBRA extended until Medicare kicks in. Friends, this train is leaving the stations. Are you on board? Do you have trouble reading your policy or claims forms? Wouldn't life be wonderful if 4 pages said it all, and in 12-point font?
16.
These forms look just like humanities. Goodbye confusion. Hello transparency. Hello standardization. Now this train is smoking. I like donuts, but seniors aren't nearly as fun as the drug donut hole. It's going to take a bit, but that hole will gradually disappear. And if income is above poverty but too low to buy insurance, affordability credits or subsidized premiums come to the rescue. And now the piece de resistance. For decades, insurers have divided the market and conquered. Year after year, they peeled off and smaller, healthy groups draining the community pool of its healthier people. After years of abuse, the smallest pools that include small business and individuals have a disproportionate number of sicker, older people. That is the trap that Anthem of California found itself. I was quoted last week in the New York Times saying that what Aetna did was actuarially sound, or I guess what Anthem did. It's the marketplace that's broken. Now, reverse this fractured market. Enlarge the pools to include a more balanced group of people. Costs come down, risk come down, prices come down. Reform calls these new pools insurance exchanges. The Senate bill calls for 50 exchanges. But if that doesn't work, there's always the House version with one huge national exchange. And if that doesn't drive down costs, there's the government-run health insurer, which we affectionately call the public option. Again, this won't happen overnight. The bill won't do it all, and it won't happen as quickly as everyone in this room would like. But success will come. So please, don't get too strung out in the weeds. There's much to like in what can and will happen. More importantly, it surmounts the biggest hurdle, getting a health care reform program on the books. Once there, it is far easier to amend with improvements than to fight the fights we're having today. Thank you. And please keep your eyes on the marbles.
Right.